Alright, in this audio, we will begin with Chapter 50, Care of Surgical Patients. So, when we talk about perioperative nursing, that's care that's before, during, and after surgery. Preoperative care would be before surgery. Intraoperative care would be during surgery. Post-operative care would be after surgery. So perioperative just means the whole process, the care before, during, and after the surgery. But when we're speaking about before, during, and after individually, before would be preoperative, during would be intraoperative, and after would be postoperative. Now, we do classify surgical procedures, and classification of surgical procedures is in 3 categories. So we have based on the seriousness, based on urgency, and based on purpose. Now, as far as the seriousness, we have major and we have minor. Now, these describe how serious or extensive the surgery will be. A major surgery example would be a colon resection. A minor surgery would be a facial plastic surgery. Okay? Urgency. So we have seriousness, urgency, and purpose. Now with urgency, we have elective, urgent, and emergency. Elective is something that the patient chooses to do, such as breast implants. Urgent is necessary for the health of the individual, and an urgent surgery can prevent development of more problems. So maybe removal of a cancerous tumor. Okay? An emergency surgery must be done immediately. Okay? A traumatic amputation, an appendix removal that has for the appendix that's been ruptured. When we talk about purpose, we have diagnostic, and an example of a diagnostic would be an exploratory lap or an exploratory laparotomy. Now, ablative would be considered removal of an appendix, okay? We're removing that diseased body part. Palliative would be to relieve or reduce intensity. Palliative surgery does not give a cure, okay? Maybe we're resecting nerve roots to help control pain, okay? Or maybe we're removing a tumor because it's so large that it's obstructing someone's vision, okay? For reconstructive, an example of reconstructive would be an internal fixation of a broken bone. Now, when we talk about procurement is for transplant, okay? That's a removal of the deceased's organs. Constructive, that's whenever we repair a lost function, such as a congenital abnormality like cleft lip. As far as cosmetic purposes, that would be an example would be rhinoplasty, okay? Now, we do have different stages that we define a patient by as far as their history, okay? So we have ASA. Okay, so ASA1, that would be a normal, healthy patient, okay? ASA2, that would be a mild systemic disease. So maybe that patient's a smoker. Maybe that patient's an alcoholic. Maybe they're obese. Maybe they're pregnant. Anyone that has well-controlled diabetes or hypertension would be considered an ASA2. Okay? ASA3, that's whenever these patients are going to have a severe systemic disease. So an example would be poorly controlled diabetes or hypertension. Maybe the patient's suffering from COPD, morbid obesity, drug abuse, or they have a pacemaker. Now, ASA4 is a severe systemic disease that is a constant threat to life for these patients. So maybe a TIA in the last 3 months, sepsis, myocardial infarction or MI, CVA, cerebral vascular accident, or end-stage renal disease with no dialysis. Now, a TIA is a transient ischemic attack. Okay. Now, ASA 5, that is when a patient is not expected to live without operation. So, for instance, someone who has a ruptured aneurysm would be considered ASA 5. Anyone with massive trauma, an intracranial bleed, an ischemic bowel, okay, these would be considered ASA 5. ASA 6 is when a patient is declared brain dead and their organs are being removed for donor purposes. Okay, so when we talk about patients with with obesity, they are at more risk for atelectasis, pneumonia, and death. Okay, now it's important to remember that those bariatric patients, and bariatric just means your obese patients. So for bariatric patients, we have to remember that a few comorbid factors exist for these patients, and those would be things like obstructive sleep apnea. You might see it abbreviated as OSA, hypertension, coronary artery disease, diabetes mellitus, CHF, or congestive heart failure. Okay? So, some factors that place older adults at risk for surgery, we have decreased respiratory muscle strength, and that allows for a risk for pneumonia or atelectasis to occur. Decreased renal function in those older adults, that can cause shock with blood loss. We can have fluid, we can have electrolyte imbalances. Sensory loss. So these patients may not be able to realize early complications from surgery. And there's also decreased reaction. Now, we do have certain conditions that increase the risk of surgery. Okay, anyone with a bleeding disorder, okay, possible hemorrhage. Anyone with diabetes, they're susceptible to infection. If anyone has heart disease, there are increased demands on the heart during surgery. Hypertension, that can lead to stroke. OSA, or obstructive sleep apnea, those patients are at risk for desaturation, or you might hear it desatting. Okay, renal and liver diseases, those patients with renal, which is kidneys, and then hepatic, which is liver, they have an altered excretion and metabolism of drugs. Okay, we have the immunocompromised, they're at an increased risk for infection. We have those with chronic pain, they have a higher tolerance to pain medications. Okay, they may need an increased dose of meds so they can be treated. Now, I will pick up in the next audio starting with VTE, venous thromboembolism.